there was nothing for you to start with from the Department for Health?
No.
And you detail in your statement, Ms MacNamara, you say you've gone back and thought why you didn't challenge this earlier, why you had this assumption, which, to be fair, we've heard you shared with many other people, that there were these plans in place. And you give a number of reasons, and I just want to pick up, in fact, on the last one. So if we can go to page 20 of your statement. It's the little Roman 6 at the top. You make the point that the Cabinet was told, in your words, time and time again by the Health Secretary that we had plans in place.
Yeah.
In your hearing?
Yes.
Was there any ambiguity looking back?
No.
Had you assumed that when he said that, he knew what he was talking about?
I assumed he'd seen them and been through them and thought they were adequate. I thought that's what he was saying.
As it turns out, that really couldn't have been the case, could it?
I mean, you'd have to ask him, but I would not understand a scenario where these plans did exist and yet we never got them.
You refer to one particular incident, which obviously was one that you remembered. Now we're in early March, and in fact you've linked it to the day when there was an issue about the Prime Minister shaking hands at the hospital, which we know was the 3rd of March, so you're right, it's early March. And picking it up about 5 or 6 lines down, you refer to the jovial tone. You say, but the jovial tone, the view that in implementing containment measures and suspending work and schooling, the Italians were overreacting, and the breezy confidence that we would do better than others had jarred with me. And just carrying on, you described raising at this meeting concerns that you'd essentially picked up at the school gate or on your sort of parents' WhatsApps, and saying surely we should just pause for a moment. And Chris Whitty supporting you. But then, to finish off, if we go over the page, you say that after that sort of moment, shortly after, the conversation went back to the assertion that we were so well prepared, we shouldn't panic. And you say you left the room even more concerned that we were in the wrong place tonally, feeling I had been patronised for raising the point, and I was particularly bothered by the supreme confidence I had heard.
I think, yes, and obviously that is accurate. I think that the thing I was most concerned about at the time is I really thought that people wanted to know the right thing to do. I wanted to know the right thing to do. You know, should we be keeping our children off school if they had a cough? Should we be seeing vulnerable people and grandparents? It really wasn't clear, and I happen to have great faith and confidence in that most of the time people will do the right thing. And I felt it was that disconnect that I felt so strongly that actually, if we could just tell people what the right and kind and proper thing to do is, people would do that. And sitting there and saying it was great and sort of laughing at the Italians was just, it just felt completely, well, it felt how it sounds.